Is it possible to have higher glucose levels if you are on the carnivore diet? Can some people still experience higher glucose levels although they do the carnivore diet? And the answer is yes, it is possible. This video has a part A and a part B. Part A is where I will talk about the topic of can you have higher glucose levels sometimes on the carnivore diet. If you go to video number 126 on my blog, you'll see Dr. Barry has a video there where he's talking about the same topic. The part B of this video is where I respond to somebody who said they are still type 2 diabetic even though they do the carnivore diet, and I do a response to that. So I'm not going to elaborate now. That is the part B. Check it out on my frequently asked question playlist. This will be video number 74, Q74 on my frequently asked question playlist. So the part B is, can diabetes, type 2 diabetes, return? Right, so let's get into it. As I said, Dr. Barry has Kendi Barry has a video on my blog, video number 126, where he talks about your healing journey. So what he say there is that sometimes some people might experience a healing process where you can experience higher glucose levels. Look, glucose is not bad in itself. Sometimes we get higher glucose levels even as carnivores, especially like when we're exercising. Our bodies produce glucose by the process of gluconeogenesis. So it's absolutely possible to convert protein to glucose if your body needs it, but it does it when it needs it. Other times when you can experience higher glucose levels in your body is when you have inflammation or infection. Then your body will produce more glucose or utilize more glucose in this specific area to facilitate the healing process and get rid of the inflammation and the infection. There are also other circumstances, for instance, where you are on medication. Certain types of medication might influence your metabolic state and your glucose levels as well. But to summarize like this, Dr. Barry talks about glycation. Glycation is when glucose binds with your red blood cells. That is where the trouble comes in. So dietary glucose, with other words, if you eat too many carbohydrates and you have a lot of glucose in your blood, the glycation of your cells, that is where the problem is. But internally, the glucose that your body produces by itself is not the same as dietary ingested glucose. And that is the point that I wanted to make with this video. So just realize that even though you're on your healing journey and you might still be experiencing a little bit higher glucose levels than what we recommend to have, just realize that it is a journey. Your body is busy with a healing process. Your body knows what it's doing. You're already doing the carnivore diet, maybe, and you're doing the right things. Your body is busy with a healing process, getting rid of inflammation, getting your metabolic syndrome correct, the measurement around your belly, if it's too big. It's reducing that if you do the carnivore diet properly and strictly, which is the part B of this video about cheating. But anyway, so there are also other processes like the dawn effect that everybody experiences. Does not matter on what diet you're on. It's in the mornings. Your blood glucose might be a little bit higher. It's just how nature works. When you wake up, your blood glucose is a little bit higher. Other factors like stress has an influence absolutely on your glucose. Hormonal situations like cortisol plays a huge role as well. Stress factors, as I've mentioned, absolutely can influence your blood glucose. If you have stress in your life, you can experience high glucose levels, and it's just your body's way of dealing with that stress. It's not necessarily a bad thing. However, diabetes starts at a level of 6.5. Pre-diabetes is 5.6 to 5.9 on the glucose scale. There are tests that you can do to find out if you are diabetic. Of course, there's the glucometer, but then there is also the hemoglobin A1C test, which is basically a 3-month test, a test over 3 months, where they determine what the glycation on your cellular level is with the hemoglobin. The hemoglobin is very important in your body, but the hemoglobin A1C test is a very good test. It's a much better test than just the fasting glucose, because many people test normal when they fast, but when they do the 3 months A1C hemoglobin A1C test, then the true picture arises. And as I often say, even though people test beneath 6.5, they are sometimes pre-diabetic, 5.6 to 5.9, and even just below that. But what happens is your insulin goes up. Your insulin keeps your blood glucose stable until a point where it does not do that anymore. And insulin resistance keep on increasing as you are eating wrongly. Unsaturated seed oils, carbohydrates, too much carbohydrates, processed food, too much sugar, all those things. It keeps on increasing your insulin because your insulin tries to keep your blood glucose low. So when you go to your doctor, your blood glucose might test so-called normal, and your doctor will say, no, you're not a diabetic yet. But your insulin goes up, and insulin makes some people fat, not always, but insulin, too much insulin resistance upregulates your uric acid retention on your kidneys. So now you have high uric acid levels, and insulin resistance in some cases also upregulates your salt retention on your kidneys, and now you have high blood pressure. So like I said, each of us are on a different healing path. Some of us were very metabolically ill, had a lot of metabolic problems and challenges. Some of us were very, very obese. And listen to the part B of this video as well. The third test that you can do is the C-peptide test, and that has got to do with your pancreas. That is where they look if your pancreas is still functional and working. It's a very interesting test as well. That is video number 127 on my blog, carnivore.blogspot.com. And of course, as I said, go and watch video number 126 on my blog, where Dr. Barry talks about higher glucose levels on the carnivore diet, if it's a problem or not. And as I said, it's really not a problem, but as always, discuss it with your doctor. Just as a matter of interest, many doctors will tell you that a glucose level of 7 is fine. No, it's not. That came in where they said that levels above 7 start to get a higher risk. But if you are 7, it does not mean you are fine. Dr. Barry say, get your blood glucose levels as low as you can get it personally. Not everybody will get it beneath 4.5, but get it as low as you can do it. Be as strict with your carnivore diet as possible. Do it properly. Don't put sweet taste in your mouth. Eat until you're not another bite full. Only eat animal products, and don't cook with unsaturated seed oils such as canola and sunflower. Only use animal fat.
So you say that you are on the carnivore diet and you are still diabetic. First question, how long are you on the carnivore diet? Second question, are you still on the carnivore diet? Third question, how strict are you with your carnivore diet? Fourth question, what are your blood glucose levels currently? And what were they? And what are they currently? So let's get into the question. Diabetes starts at a blood glucose level of 6.5. Prediabetes starts at a level of 5.5 to 5.9 on the glucose scale. If you don't eat carbohydrates and you don't eat unsaturated seed oil, you don't eat sugar, and you only eat animal protein and animal fats, your body will drop your blood glucose immediately. That's why I always say, discuss the carnivore diet with your doctor before you start the carnivore diet. Any diet, before you start any diet, discuss it with your doctor. Because if you start the carnivore diet, like I said, your blood glucose will drop. And if you are on blood glucose medication, the medication will be too strong and your blood glucose will fall too far and you won't feel good. The same with hypertension. Your hypertension will go away eventually with the carnivore diet within 2 months. But if you don't reduce your medication together with your doctor, your medicine will be too strong and your blood pressure may fall too far. My point that I want to make is, where are you on your journey with the carnivore diet? Because if you say you are still diabetic, that means that your blood glucose is still above 6.5. It is possible to have blood sugar levels below 8, above 7 on the carnivore diet. It is possible. But that's not the end of the world. But that does not mean that you are diabetic in the sense of having blood glucose of 20 or 26 on the glucose scale. You will still have quite not very low blood sugar levels like 3.5 and 3.9 or 4.5, but you will still be at a level of maybe 7 or 7.2 or something like that. That's why I say, why do you say that you are still diabetic and you are on the carnivore diet? Where are you with your health process? Look, the carnivore diet is not a magic wand. If you start to do the carnivore diet, all your problems does not go away. But it improves very, very quickly. Go to my testimonial playlist on my YouTube channel and see where I interviewed people who reversed their type 2 diabetes within 18 days. Who got their blood sugar levels down from levels even as high as 39 to 3.9. All right. So what I want to say is, where are you at with your health journey? Why are you saying you are still diabetic? To get back to my earlier question, are you still on the carnivore diet? Are you still doing the carnivore diet? Because many people tried the carnivore diet and they did not follow through. They did it and they were not patient enough. And they stopped it and they say, no, I did the carnivore diet and I'm still diabetic. No, you did not do the carnivore diet right. You have to look at the carnivore diet in a long-term perspective. It is not a fix-it-all, overnight, calorie-restrictive type of diet. It's a lifestyle. It's the proper human diet. It has the proper nutrition, bioavailable, nutrient-dense food that your body needs. It's the ultimate elimination diet. And you can sort out your metabolic health. The second part of this question is, what is your metabolic health like currently? What is your metabolic syndrome look like currently? With other words, what is the measurement around your belly divided by your height? It should be 0.5. If it is bigger than that, if that measurement around your belly divided by your height is bigger than 0.5, you're metabolically ill. What does your hypertension look like? It's got a 4.5 risk factor for heart disease. What is your metabolic rate or metabolic syndrome look like? The one that I just described. It's got a 6.0 risk factor for heart disease. So even though you reversed, or a person reversed their type 2 diabetes, which means they measure below 6.5 on the glucose scale, it's easy to do that. You do it very, very quickly by cutting out all carbohydrates. Don't eat unsaturated seed oils such as sunflower and canola. And don't consume any sugary products. Don't put sweet taste in your mouth. Only eat animal products. Only eat animal fats, saturated fats. And I include eggs and dairy. And you will drop your blood glucose for sure. But it does not mean that all your metabolic problems are sorted out. Many people that I've interviewed, for instance, sorted out their blood glucose levels very quickly. Within the first week, they sort out their high blood glucose levels, even to very close, within 2 weeks, within 3 weeks. Many of the guys that I interviewed on my YouTube channel, although their metabolic syndrome, the measurement around their belly was still not fixed at that stage. Their blood glucose levels came down to the point where their doctor said, no, we can stop the glucophage, the type 2 diabetic medication now. We can take you off glucophage. The doctor does that. But if that person went back and start to eat carbohydrates again, of course you will become diabetic again. The dose is the poison. So if you stop the carnivore diet, or if you cheat on the carnivore diet, you will become diabetic again. And then you can't blame the carnivore diet. I always refer to one specific lady that we caught out on this TikTok channel. She was making a lot of noise, and she's saying, yeah, the carnivore diet was hurting her, and she has now other metabolic problems because of the carnivore diet. And then we did some research, and we found out that she had a history of cheating on other diets. Way before the carnivore diet, she was known for cheating on her diets quite a lot. And that is the problem. People turn around and they say, what was I busy with right now? Okay, I was busy with the carnivore diet, so it must be the carnivore diet which is at fault, right? It must be this carnivore diet because I'm busy with it now. No, you took decades to become sick. You took decades of bad eating habits, bad consuming habits, drinking habits, carbohydrated drinks, sugary drinks, and whatever you ate that were causing your metabolic problems, that were causing you to be type 2 diabetic. And that brings me to the final point. How strict are you with your carnivore diet? Are you allowing sweet taste in? Are you allowing sugary sauces in? Are you drinking alcohol still? Because that will absolutely influence your blood glucose as well. Many times people will say, but yeah, I did the carnivore diet, but did you do it right? Did you do it very strict? I'm not there. But what I will suggest is contact me on my email address. It is in the link. You can talk to me there on my email, as well as you can book me for a consultation, a coaching consultation. I would love to help you if you are really interested. But in many cases, I found that people are not serious about their own health, and they are not committed. But if other people did the carnivore diet with success, then you can too, if your kidneys are still fine. Your kidneys must be fine to do the carnivore diet. At a kidney failure of level 3, you can still do the carnivore diet, but not at the level of 4, stage 4, where you have 30% or less kidney function left. But thanks for your question.